and welcome back to Season 5 of the Lighting Your Way podcast. My name is Betty Long, and I am your host during these conversations. I do hope that you enjoy them, and I look forward to hearing your feedback. In this episode, we talk with Mike Previtera, Fund Administrator with District Council 21 of the International Union of Painters and Allied Trades in Philadelphia, about his life-changing experience thanks to the heart scan, a painless, non-invasive test that helps reveal your risk of heart disease often before other warning signs appear. With Mike is Guardian Nurses Vice President Rebecca Czarkowski, who at the time was Mike's nurse advocate. Mike Previtera, Rebecca Czarkowski, welcome to the Lighting Your Way podcast.
Hey, Betty, how are you?
Hi,
Thanks
Betty.
for having me.
Good, thanks. Mike, you're a first-time guest, and Rebecca Czarkowski is our vice president, but in this role, and in this conversation, she was your nurse advocate way back when. Rebecca, welcome back.
Thank you.
You're getting to be a veteran.
I know. My new career. Look out, Hollywood.
All right, Mike. You're currently in your day job. You're currently the Fund Administrator for District Council 21, which is a group for the International Union of Painters and Tradespeople. Is that correct?
That is correct.
Yeah.
Yes.
So, the Fund Administrator, I'm certainly familiar with it. Rebecca is, but what is it that you do for your membership?
So just to give you a little history on actually how District Council 21 works, it's actually an umbrella of 4 trades. So it's the Glazers Union, Painters Union, Drywall Finishers, and Wallpaper Hangers. And so I am the Fund Administrator of District Council 21, and I oversee 12 employees that work in the office here with me on a daily basis. And we oversee the members, active members and retirees and their dependents' benefits.
And the benefits are health and welfare benefits. Does it also include pension as well?
It does not include pension. So we do handle health and welfare and their members' annuity fund. Okay.
Right. And your experience, I mean, we're talking about the heart scan today, but your experience as a fund administrator, like, how did you get to the heart scan with DC 21? What was the connection?
So, I guess it was about 18 years ago when I actually got in the union. I was a glazer, worked out in the field as a glazer for about 8 or 9 years. And when I was on the job site, I actually always hear a lot of the members talking about this heart scan. And I was, always interested in hearing about it, but apparently the machine broke and it went away and didn't hear much about it. And then fast forward to a couple years later when I actually became the fund administrator, Temple started to roll out this heart scan program, which I remember the members talking about. So I always thought, wow, that would be great. I know the members like to get those scans done. So I said, what a great opportunity to, bring it back.
Okay.
And, allow the members to start it up again.
So, Rebecca, I'm going to switch over to you as the nurse, right? So Mike's got this opportunity to have his members do a heart scan. Can you define, for our audience what a heart scan is?
Sure, absolutely. It's best way to describe it. It's a non-invasive scan, like a CAT scan, basically, that can predict the plaque in somebody's heart arteries. So in certain situations, it's very useful to determine risk factor for heart disease. I mean, that's really what it's designed to do.
Okay. So, and anybody, I mean, it's not covered by insurance, I don't think now, is it?
It is not. It is not. It's sometimes it's called a calcium scan. Sometimes it's called a calcium scoring scan. Sometimes it's part of like a cardiac CT, but it is not covered by insurance. You do pay out of pocket. It is not a lot of money. Well, I guess that's relative, right? But for what it tells you, it is not an unreasonable amount of money.
Right. Relative to other
Betty,
tests.
We treat that as I'm sorry.
Go ahead, Mike.
No, I was just going to say that we actually treat it here at District Council 21 as an in-house benefit for the members.
Okay. So you're the fund administrator, and you are reintroduced to the heart scan through Temple. And what do? You're trying to set a good example. So tell me what happened.
Yeah, so sure. So, I would always go to the membership meetings and promote this heart scan. So I kind of felt like a hypocrite in a way, because I was telling all of our members to go get this scan done. So I figured, you know what, I better go get it done myself. So
good example.
Kind of
Very
how
good.
it went. Yeah.
Leadership.
Yeah.
So you went to get the scan 6 years ago, and what happened? I mean, you're a young healthy man, right? So you go to get the scan thinking you're okay.
I sure did. So yeah, it was about 6 years ago around this time I went and got the scan done, and didn't really think much about it. And I realized, a couple of weeks have gone by where I didn't get the results. So I was actually going to call them, and right when I was going to call them, they actually reached out to me. I kind of remember it pretty vividly. They called me on a Friday afternoon in May, and it was a nurse who was reaching out from Temple. I answered the phone, and she said, is this Mike? And I said, it is. And she said, this is such and such from the Temple heart scan. Just wanted to kind of fill you in on some of the results that we found on your scan. And she said, basically your heart looks great. You had a 0 score, but we did notice that we found a nodule on your right lung. It was about the size of a dime, if I remember correctly. I think it was like 9 millimeters.
Wow.
Yeah, and I just kind of remember standing there in the bewilderment, and I didn't really know what to say or do. So they suggested, that I come down to Temple and follow up with a pulmonologist. And so then I think I called my wife first, and then I called you guys second.
Well, and I mean, the good news, you got a 0 score for your heart, but the not so good news is they found something, which, is an indirect benefit, obviously, of the test if they're looking at your chest, right, and can see.
Correct.
Did the Temple folks, did they get an appointment for you with the pulmonologist, or did you have to do that on your own?
No, they did. Yeah.
Okay. So what happened when you went to that pulmonologist? Did Rebecca go with you at that point?
I think Rebecca was there at that time. So basically, when we met with the pulmonologist, she said, you're kind of in a conundrum here because of the location of where the nodule was. So it was right next to my aorta. So they said the normal procedure would be to go in and biopsy it. But since it was so close to my aorta, they didn't want to do that because they were afraid they could take the chance of nicking my aorta. So basically, I had 2 options, and that was, one, to wait and get another scan in a month or 2 and see if the nodule grew, or I could have a lobectomy.
Okay. Wow.
Yeah, so I think me, my wife, and Rebecca, we walked out of there, and we all decided that we should get a second opinion.
Good idea. Very good.
Yeah.
You've been schooled well.
Yeah. So we scheduled a second opinion with Penn Presbyterian, went and met with that doctor, and that doctor pretty much told me the same exact thing the Temple doctor told me.
Okay.
So.
And so Rebecca, you're at the Temple appointment, right? And you're hearing what Mike's hearing. What are you thinking at that point?
Well, they were leaning certainly towards watch and wait until another scan. And that made me a little uncomfortable. He's a young man. He shouldn't have something in his lung. He's a non-smoker. He's athletic. It didn't sit well with me, which is why we kind of said, let's just go get somebody else to weigh in. And then when we did, what I appreciated about that assessment was we had the ability with the doctor to actually look at the films. And he was looking at, if you remember, Mike, right, this cellular level, like the actual shape of the cells, which were in his mind clearly positive for cancer because they were irregular and the shape that they took on. He believed with no doubt that this was cancer. And so we could watch and wait, but the end result was going to be this lobectomy regardless.
Okay.
Yeah.
Right. And why did the Temple, I'm just curious, was there not, because they had the films, right? They did the original heart scan. Why didn't they have the films to show you during that appointment?
Honestly, I don't know.
Okay. I was just curious, but
Yeah.
I mean, it's a great visual when somebody can get, actually look at it. I know patients appreciate that when they can, and especially if a doctor is interested in showing them as well, so you're looking at what you're looking at.
Yeah.
So Mike, you decide you're going to go with the lobectomy, right?
We did. So I think the next step in the whole process was I went and had a PET scan done. And, both, I think they were both recommended by Temple and Penn, to have that be the next step. And then they said if the nodule lights up, it's a good indicator that it's most likely cancer. So I went and had the PET scan done, and unfortunately, yes, that did light up in my lung. But it was the only thing that came up on the scan, which was good. So
yeah.
So that was the next step. Had the PET scan, and then decided to have the lobectomy done in September.
Okay.
Yeah.
So and you had it done. How did you do? I mean, Rebecca, were you involved in that at all? Would you go down to see Mike?
Yeah. He did great.
And what was it?
I spent maybe 3 days in the hospital.
Okay.
Came home on oxygen, but I think the procedure went well. They said there was nothing in my margins, nothing in my lymph nodes. Didn't need chemo, didn't need radiation.
Right.
They caught it so early that I was very fortunate. They did say it was if I remember correctly, it was a slow-growing, non-aggressive carcinoid.
Wow.
Yeah.
Wow. I'm. You must have been stunned. I mean, right? No symptoms, right? No shortness of breath. No.
Nothing.
No weight loss.
And like you said, wasn't a smoker. No weight loss.
Yeah.
No pain. Wow. Nothing. I think my wife was more stunned than I was because she thought for sure it was going to be nothing.
Right. Well,
she works in the medical field, so. But yeah.
Listen, I'm sure the radiologist reading the study was surprised as well, right? Because again, you present as a young, healthy man with no smoking history, right? And they're looking at your heart and see a little lesion. So, we see that. I mean, Rebecca and I see that all the time. I mean, our colleagues do at Guardian Nurses that, tests are done and, incidental findings come out.
Well, I can add to that. Yeah, I can add to that. So when I had my PET scan, that's when I found out at 43 years old that I was born with one kidney and never knew it.
Whoa.
So they found that out on the PET scan.
Oh my God. I'm surprised you're not afraid to go into tests anymore. It's like, wait a minute. Again, the good news.
I had white coat syndrome prior.
Right,
now I really have it.
Yeah, no kidding. Wow.
Yeah.
Jeez. Oh my gosh, really? So you do a PET scan and they're like,
so I have a half a lung, one kidney.
Jesus.
I'm like a mummy.
But you're still, you're doing well. You're doing good.
I'm still kicking here.
Besides one kidney and half a lung, how are you doing now? Is there any follow-up that you're doing? Are you getting regular scans still, or what's?
So I do. I get an annual scan down at Penn. And knock on wood, so far so good. Everything looks great. Actually, my last scan was back in November, and they told me, because that was my 5th year scan, they told me I didn't need to have any more if I didn't want to. But I said, well, if it's okay with you guys, I would prefer to keep coming down.
Right.
If not every year, every other year. So just to give me peace of mind. So
yeah. Wow.
Yeah. So next year, next September, November, I'm scheduled for my 6-year scan, and then I think maybe after that I would go every other year.
Okay. And how about are you? So you're not getting you haven't gotten the heart scan again, right?
I have not. I have not. No.
But is your membership still getting it? Are you still supporting it from the fund?
They are. Yes. Yes. And since then, we have actually added a scan for the lung as well, with the help of guardian nurses.
Oh.
So our members can go and get the heart and the lung scan done at the same time. Two different scans, but can go down on the same appointment and get the scan done if they choose to do so. Yeah.
Do you know of any members that have had difficult results, or?
I actually haven't heard any. No, as of now. So the lung's been up and running for maybe a little over a year now, but no, I haven't. Not as far as the lung goes. Now we do have members who have some high plaque scores with the heart.
Okay.
But yeah, as far as the lung, I haven't really heard anything.
And Rebecca, when members do get a high calcium score, right? What's the follow up for them? What does that indicate for them?
Yeah, so they'll get a call from the ordering physician, who would then review the scores with them. They go from, I believe the scoring is there. I think it goes from, it should be 0, right? There should be no plaque, but once you start going 1 over 301, so I think 1 to 10 is like minimum. If you have a score of 1 to 10, it's minimum. 11 to 100 is mild. 101 to 300 is moderate. And then above 300, you're considered severe risk for heart disease due to the plaque that's growing on the coronary muscle. And so you can't reduce the score, but you can prevent further increase. So if you were sitting somewhere 100 or lower and you're looking at this risk factor of minimal to mild, you may go on a statin. So it won't reduce you down to a lower number, but it would prevent that, perhaps, depending on what the doctor feels is appropriate, from increasing. And that's obviously the ultimate goal, is to prevent any kind of heart disease, would be to keep that plaque at a minimum, if none at all.
Okay. Right. And do we know that in terms of the demographics, like who should get a heart scan?
Yeah. So, from all the current stats, it's looking like between ages 40 and 70-year-olds with an increased risk of heart disease that do not have symptoms. Okay. So that means like a family history would be an example of what that risk factor looks like. So I had gotten one done a couple years ago because of my family history, my cardiac family history, and it's deep and it's big. And I came in just at 100, and I did it before I was 50 even. Oh God, now I'm telling the whole world my age. But anyway, it definitely makes you more mindful, knowing the bad outcomes that could happen. I feel like you're more, even if you don't run off back to the doctor or change anything, with medication and pharmacology intervention, your lifestyle intervention, you're just more in tune with it. So that's also a huge help, right? If you start exercising and eat better and worry about your cholesterol, you'll also reduce the risk of hopefully of increased plaque, unless family history takes over.
Okay.
Betty, I can tell you this, when we rolled out the program, we set the parameters for males at the age of 40 and females at the age of 50. Okay. And then since we've added the lung, we actually reset and we lowered the age for the female down to 40 as well. So currently, anyone over the age of 40, male or female, can get the scan done.
Okay. But it's still a benefit of being a member of DC 21. It's not because it's covered by the insurance.
Correct.
I don't understand why they wouldn't cover it if it's it's identifying, in your case certainly, a catastrophic result, right? If you didn't know that you had that lesion, it would have grown and gotten bigger and perhaps metastasized, where it was treatment was going to be chemo, right, and surgery.
Yep.
So I'm not sure who's making the decisions, but Rebecca, when you you're working with a cardiologist can a primary care doctor order you don't really need an order for this test, right? Or do you?
I think you do. I think you need a script. And yes, I think you can I got mine from my PCP, not a cardiologist.
Okay, great. And Mike, do you know how much you pay for the heart scan and the lung scan?
I do. So for the heart scan, it's $250 a scan.
Okay. Yeah. I mean, like you said, Rebecca, an investment, right? Especially if it's non-invasive, you can pop in. I think it takes all of, 15 minutes. I think finding a parking space might be longer.
That's what I would always tell our members. It takes longer to find a parking spot than it does to actually have the scan done. Yeah.
Mike, do you do you often tell your membership about it? I'm sure at membership meetings or kind of as your personal story.
I do. So actually, what I will do is when we bring in a new apprentice class every year, I'll go over and I'll explain all the the benefits that the members are going to be receiving, and then I'll fill them in on my story. And so I would say maybe once a year I'll kind of fill the members in on basically that this scan saved my life.
Yeah.
So.
Yeah, I mean, listen, it's a powerful story. It's what people come away with. You're standing up there telling your story. It's hard not to remember, oh, that guy had a heart scan and they found a lung lesion.
Yeah.
Rebecca, have you had any other patients like Mike who've had other incidental findings in a scan?
Yeah, I think I had one other patient, and it was the calcium scoring on the heart was insanely high. I want to say it was 500 and something. And we referred him directly to cardiology, and I believe that he ended up with a cath and a stent and all new meds, like a whole new, but, again, avoided an MI, right? Or a heart attack, I guess, to say it that way. And so, there's great wins there. Just even, it doesn't mean that everybody's going to have a normal. A lot of these things might be actionable, but if you can catch them early enough, look at Mike, it's a win.
Mm-hmm.
Yeah. Mike, otherwise, I mean, have you been otherwise healthy since that incident?
That I know of, yes.
Knock on wood.
Yes, knock on wood.
Yeah, don't get any scans. No, but I like that's got to be because that was probably a pretty traumatic experience for you. Has it changed you or your not approach to healthcare, but has it changed your, I don't know, experience with it?
I always, let the members know to go get their mammograms done and their colonoscopies done. Right. And things like that. So the preventative care.
Yeah, for sure. Right. Yeah, so, you're a perfect story for that. Yeah, because I mean, I know when we talk, Rebecca and I will talk to groups, and even at health fairs when we're trying to tout preventive screening, it's always you never think you're the one, right? You never think you're going to be the one that something's going to happen to, and
that's right.
Just get it done. Yeah. Well, thank you. Rebecca, do you have anything to add about the heart scan? I want to give you an opportunity to weigh in.
No, I do think that if people are listening, if there's value in discussing it with your physician. I know it's not standard of care yet as far as cardiac assessment, but I think that the information you pull from it can be helpful, for you and your family.
Yeah, I know.
I would encourage you to discuss it with your physician.
Or your healthcare provider, because you may have a nurse practitioner.
I'm sorry, you're right. Or your healthcare provider. Thank you, Betty.
Well, and to Mike's point, like way back when the heart scan, I remember what Mike was talking about. Like there weren't a lot of doctors who were positive about it or endorsing it. They kind of poo-pooed it. But they've continued to do the research, and with stories like Mike and with stories like your patients, Rebecca, that it can prevent a traumatic event, a catastrophic event like a heart attack or something worse, right? So I think over time, I think cardiologists are more open to the heart scan, which is good. right? But that's because there's been more research and more results that they can look at, because, physicians are typically data driven, right? And standard of care. So it's good to see that they finally have kind of, opened their hearts, open their hearts to it. So Mike, congratulations. I'm glad you're here, and I'm glad it all turned out.
Thank you, Betty. I'm glad I have you guys.
Thank you.
You guys were there for my journey and guidance.
And Rebecca,
so thank you.
Another feather in your cap, Rebecca. Congratulations.
There you go.
Guiding Mike. Guiding Mike for his journey. You still got it, kid. You still got it. All right, Mike, thank you for joining us. Rebecca, thank you for taking the time.
Sure.
I enjoy it. And my continued good health to you.
Thank you.
All
I
right.
appreciate that.
Okay, take care.
Bye-bye.
Take care, guys. Bye-bye.
If you have any questions that you would like us to address in a future episode, please email us at podcast@guardiannurses.com. That email again is podcast@guardiannurses.com. We would love to hear from you. Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, Google, YouTube, Spotify, and Stitcher. If you liked what you heard, tell a friend and leave us a review. You can learn all about Guardian Nurses Healthcare Advocates on our website, guardiannurses.com. So until next time, find some joy in your life, pet all the good doggies and kitties, and remember to tell your people that you love them. Take care.